In 2008, with the support of the European Union, funding was given to UNICEF to work with the government of Lesotho to begin a program of cash transfers to households with vulnerable children based on an evaluation that was done. They realized that one of the challenges was to target effectively.
The social protection programs in Lesotho, they don't complement each other. Each one moves its own direction, targeting the same people, using different targeting methods. And in the process, the support does not reach the intended beneficiaries, who are the vulnerable. And there are duplications, there are exclusions and inclusions, and the result is lack of impact.
Nissa is the acronym for National Information System for Social Assistance. It's actually a database that has been designed for categorizing the people by levels of vulnerability. We started first as a pilot in 2008 when Lesotho was really hit by this spread of HIV and so many children were made orphan, and we had to find a way to help the government respond to that problem.
To objectively and transparently target and select those that are in need of support. That it does it through going around the communities, registering all the households, bringing in communities together to categorize them into the different wealth groups and to ultimately enroll them into programs that they are eligible for.
We have three phases when we're conducting the Nissa survey. It's community mobilization and sensitization, then full survey, then the last stage is community-based categorization. We meet with the community and tell them what the Nissa survey is about. We go house to house to get all the information. When that is completed, we organize the community-based categorization gatherings. The community now categorizes themselves according to the 4 categories that we provide.
We use a community-based categorization method where community categorizes each and every household into 4 categories, starting with ultra-poor, the poor, going to those who are well-off, and those who are moderate. These 4 categories are selected looking at 5 characteristics in terms of income, food security, ownership of livestock of the household, the ability of the household to send children to school, and lastly, the ability of the household to participate in agriculture. And this is done in an open setting where the community sits in a gathering and categorizes each and every household based on their knowledge of these households.
It brings in objectivity in the sense that the process is very transparent. That is very important. But also the system goes further than that to ensure that you are also enrolling the right people into the program. You pay the right people in the program. And then when people have grievances, we use the system again to record their grievances and to provide feedback.
It helps eliminate duplications, especially if it's linked to the national identity system.
And now we are using a spatial imagery system so that you make sure you don't omit any outlet, because sometimes they're isolated. You go to a village, you don't know that 2 kilometers away there was maybe 2-3 houses.
And it's been phenomenal because we just realized that there were households or almost entire communities that the census hadn't even recognized existed.
In community-based targeting, they are leading us to the poorest of the poor members of their communities. We have developed our own mobile application for collection of data. We are using tablets that we have bought with the support of EU and UNICEF, and data is collected directly from the field and synchronized to our Nissa database here at the center. Now the work is faster. We can have data in our system in real time.
In Lesotho, due to its terrain, there are many places which are not very accessible. And this is where the very poor people, who are the key targets for social assistance support, reside. The cost of transporting money, security and all that are massive. And you will find that 3 or 4 programs going to the same area, each one incurring the same costs. Now with Nissa, we can consolidate that and have one delivery mechanism for all different programs.
It enables UNICEF to reach the children that are in need of support. We are targeting households living with children to make sure that those children remain in school and complete, at the least, their primary education. Secondly, it enables those households to make sure that they receive their health services like immunization and growth monitoring.
By receiving this injection of cash in the economy of the families has boosted also the local economy. 1 loti that you inject in the household has the potential to generate 2.23 maloti in the local economy. The other benefit is this: it has boosted the self-esteem of the families. They are now part of the community. So it has given dignity to the families, and this is remarkable.
Perhaps we never envisaged that one day we could use Nissa to respond during emergencies. But today we have done it twice and it works.
There was the El Nino drought, and we used the Nissa database for the 26,000 odd families that were already receiving cash grants to increase the amount so that those families could be buffered through that lean season.
We would not have been able to do this if it were not of the support that we get from the European Union and UNICEF.
The European Union, UNICEF, and the government of Lesotho. These 3 partners have really been committed to providing all the necessary support and resources to enable the program to be where it is today. Having started with 3 community councils, to date I think we are close to around 48 community councils.
We consider Nissa as the backbone of the social protection here in Lesotho. The idea is that by end of next year, at least the entire rural population is covered by Nissa, so that it can be used not just by the Ministry of Social Development, but by any partners who are supporting Lesotho in times of emergencies, by other ministries.
It is also a plan of Nissa to make sure that it is decentralized to district level. It is a national database, but there are a lot of functions that can be done at district level, even at community level. Things like case management, ongoing updating of Nissa database.
And for this program to reach countrywide coverage, we actually need more resources, because you also have to build and strengthen the capacity of personnel that is actually manning and operating the system on a daily basis.
That support has been successful to a very large extent because of the maximum use of the limited capacity and actually the ministry staff developing capacity within this very short period of time due to the support, and I hope that will continue.
They will know at any given time the population that they have in the country, the number of children that are in the country, the number of children and households that are in need, that are vulnerable, and that have to be reached quickly by services, and especially when it's an emergency.
I'm very optimistic that if we do implement all this, it will make a difference in the lives of the vulnerable.